let's talk about aging a little bit, because it is not a one size fits all. Aging has to do with environmental factors, what we eat, what skincare products we use. So there's a lot of things that can affect the aging process. So aging, really, that process starts probably around, I would say 21, 22 is when we start to mature and we start to show those signs more of maturing and aging a little bit. And everybody, genetics plays a role, how you eat, if you drink, if you smoke. There's a lot of factors that go into play. But how can we prevent aging? Unfortunately, there's no fountain of youth yet. I'm still trying to find that. But let's start with skincare first, because I think skincare is extremely important for the entire face. So I tell everybody the main things to use is going to be get a cleanser. You should be cleaning your face every night if you can. Cleanse, moisturize. You want to have hydration. If the desert's dry and your face is going to be dry, it's just going to crack and it's not going to look very clear. The other thing is, if you have acne, you want to be using a skincare product that's going to treat that acne. If you have rosacea, you need a product that's going to treat your rosacea. So you want to use your reparative products. And then a retinol to increase that cell turnover, to make that skin more youthful and turnover. And then you want to be using a good sunscreen. So everything with skincare is going to be specialized to you, and that's why it's important to have a good skincare provider or physician or a nurse or someone to guide you through what's good for you. I see a lot of sun damage on the forehead. That's because, the sun's going to hit you there the most when you're out walking and doing whatnot. So your forehead and your nose is where I see it a lot. And your driver's side of your face. So with the forehead, the main thing you can do to prevent aging is to use a good sunscreen, SPF 35 above, and you do want to apply it every couple hours. If you can't apply it every couple hours, there is a couple products out there that you can buy in a compact. A Skin Better Science is one of them that you can carry and just reapply. You could use the clear, or you could use the one that has like a little bit of color in it. Other than that, hats, keeping things covered. But if you're wanting to really focus on the forehead specifically, fine lines, wrinkles, use a good skincare product like hyaluronic acid, retinols, vitamin C to help with that sun damage that you're going to get. And keeping your skin moisturized is really also key for people to keep it so it doesn't look so dry. So there's a lot of eye creams out there, hard to choose which one is the best to use, but that's where your provider is going to recommend that's for you. If you have really fine lines, if you have deep lines, if you have dark circles, if you have a lot of redness, if you have they have little bumps underneath them, it looks like chicken skin. There's things that we can use. Maybe you're going to use a retinol eye cream. Maybe you're going to use an eye cream that has caffeine or green tea in it. There's a lot of, maybe vitamin K to help with the discoloration. There's a lot of different eye creams that are out there, but you need one that's going to target for your eyes and what your goals are. The other area that people have a lot of concern is their upper lip. A lot of women complain about the fine lines on their upper lip. So the only way to treat those fine lines, honestly, is going to be either doing a little toxin there, doing a little filler there, if those lines are already developed. If they're not already developed, then you can start pre-treating it using a topical product. You could use a retinol. Skin Better Science have some products that you can use that helps with the fine lines. There's some peptides out there, but we're going to tailor it by specifically what your needs are. If you have acne, then we're going to put you on a different skincare line that's going to cover treating the acne scarring, that redness, help prevent it. It might be a retinol, it might be a salicylic acid. We may even use like a vitamin K to take down some of that redness. We might even recommend you doing some laser treatment to get rid of that P. acne. So there's a lot of options that we have regarding acne and scarring. When it comes to your neck and your décolleté, we can always do Botox in the neck. We can always use a topical skincare product. In the chest, if you have a lot of crepey lines, we may use Sculptra or Radiesse in that area to help with those fine lines there. Also, laser and microneedling, radiofrequency microneedling I like the best. We have Scarlet here. It's radiofrequency with microneedling. It's usually a series of 3 treatments, and obviously using some sunscreen. But topical products, if you don't want to do injections, you can always come in for a consultation and we can recommend topical products if that's the route that you want to go. But just know your injectables are going to give you a little bit of a better result because it's targeting those deeper areas like your muscles. And that's where we need to start targeting, is building collagen, relaxing the muscles, giving you more volume in those areas that you've lost, because most people will start to lose volume in those tissues at an earlier age than you think, and it depends on your genetics. When people look in the mirror, they say, God, what really bothers me are these 11s. So most of the time, we're gonna just treat that area with Botox. If you have a lot of deep lines between your brows and your forehead, that's just gonna be using a neurotoxin. If you're saying, you know, my eyes are really hollow underneath, I don't like the way that looks, then we may recommend Bellatero, which is a tear trough filler that generally will last you 12 to 24 months. You're probably gonna need a couple syringes. It can cost you anywhere between $900 all the way up to about $2,700, depending on how hollow that area is. But it does last a couple years. The other area that people are really concerned about is their crow's feet. That's gonna be usually doing a neurotoxin, Botox, or Dysport. You know, that area is gonna usually cost you between, $200 to $300 per treatment every 3 months. And then sometimes if your tear troughs are really bad and you've also lost the structure of your cheek, we may recommend you doing a little bit of filler in that cheek to kind of lift it, to give us a foundation, and then do cheek filler, because sometimes if we do a combination, you might not need as much filler in your cheeks if you build that foundation in your cheek, and it's gonna give you a much more youthful look than having tear trough filler there and then you're flat here. But it's gonna be all up to what your goals are with your injector. Another area that women like to complain about that I hear is their lips. We struggle with our lips because as we age, we're losing collagen, elastin, our bones actually shrink, our muscles shift and they drop because the elasticity of our skin can no longer hold it in place. So think of, for example, you have a water balloon and you have that water balloon and you fill it up. But if you leave it out in the sun and in the elements for a period of time, it's going to shrink up. That's kind of what happens with our face as well. The skin starts to shrink, the muscles will shrink over time, the bones will shrink. And so that's where we go in and we're gonna use fillers to refill that volume. We are going to use skincare topical products to fix the skin integrity, to make it more tightness, firmness, texture, tone, and clarity of the skin. So how we accomplish getting the skin to the goal is using topical products along with maybe some laser, maybe possibly microneedling. Hydrofacials is very popular here because that exfoliates, extracts, and infuses peptides into the skin. So that helps with the hydration. So it's really gonna be what your goals are as a patient and what your expectations and what you're wanting to accomplish of what your treatment plan is going to be.